Hi, my name is Brittany Worths, and this is a comprehensive validation of cardiac, thoracic, and examination for physical assessment at Bergen County Community College. This is my patient. So, first, when coming into the procedure room, I would wash my hands thoroughly, don gloves, and identify my patient by using two identifiers. In this case, it could be either his wristband or just the documentation on the sheet. And we will begin. Hi, can you state your name and date of birth?
Nicholas Erickson, 9/13/1986.
And do you know where we are?
Yes.
Where are we?
We're in the hospital.
Okay. What year is it?
It's 2020.
With this information, I know that my patient is alert and oriented ×3. Okay, so before we begin the procedure, I'm just going to ask you a few questions before we begin, okay?
Okay.
Are you experiencing any tightness in your chest? Any chest pain?
No.
No? Any shortness of breath?
No.
What about lying down flat? Do you experience any shortness of breath?
No.
No. Okay. And what about waking up in the middle of the night to go to the bathroom?
No.
No?
No.
Okay. Do you have any fatigue?
No.
Any noticeable change of skin coloration, discoloration, or changes of color?
I do not.
Any swelling anywhere?
No.
Okay. Do you have any past history, family history, or yourself with either lung disease, cardiac disease, or breast disease?
Cardiac disease for
Cardiac
both my
disease.
grandfathers.
Okay. What happened?
They ended up getting clogged arteries and both of them had heart attacks.
What age?
83 and 82.
83 and 82. Okay, very good, thank you. Do you smoke or any history of smoking?
No.
Tobacco use?
No.
What is your drinking activity? Is it light, moderate, or heavy?
Light.
How many times per month would you say?
Maybe 5.
5? Okay. What is your activity level? Light, moderate, or heavy?
Activity meaning what?
Working out.
I would say 4 times a week.
4 times a week? And how long each day would you say?
About an hour.
About an hour? Okay, thank you. And what about, are you a diabetic?
I am not.
Very good. Any past history with either high blood pressure or high cholesterol?
No.
Okay, very good. And I'm just going to ask you a few questions about your breasts, okay?
Okay.
Do you have any breast tenderness or aching?
No. Yes.
Any redness or rashes anywhere?
No.
Any noticeable lumps?
No.
Any discharge from the nipple?
No.
When was your last breast exam?
Never.
When was your last mammogram?
Never.
Never. Thank you. Now we're going to go into the breast examination. So I'm going to have my patient. Do you mind just raising your hands above your head together like this? Good. And back down. And then one more up. And back down. So I noticed both symmetry in his breasts. Cool. So do you mind lying down?
Sure.
Actually, no, hold on. Do you mind just putting your hands on your hips? Lean forward just a little. And almost press your shoulders forward. Very good. So I do notice in his left breast that he does have some skin retraction and some dimpling. But his right breast is perfectly fine. Do you mind lying down, please? So what I'm going to do is I'm going to put a pillow. You're going to put your shoulders on this pillow. And since I noticed some dimpling and skin retraction in his left breast, I'm going to start the assessment there first. So have your hand, Nick, go behind your head just for rest. Here we go. Fantastic. So I'm going to go in and palpate his left breast. I'm going to start with a vertical stripe movement, and I'm just going to go start at the tail of Spence and just go up and down in this motion using my 3 fingers at different pressure levels. So I noticed on his left breast that he does have, I noticed some nodes up in his talus spence. I also noticed a few other nodes in his upper outer quadrant, his lower outer quadrant, and his lower inner quadrant. These nodes felt fixed and firm, and they were solitary. Now, I'm going to, if you don't mind, putting your right hand behind your head, and you can relax your left hand. Now I'm going to go into his right breast and perform the same procedure. The right breast, I noticed no noticeable nodes. And now to finalize this procedure, I will just do a quick nipple squeeze, and there's no noticeable discharge whatsoever. Now, if you don't mind sitting up just for a little bit, I'm going to position you in this 45-degree angle. You can lie back down. Okay. You comfy? Cool. So now I'm going to go into the cardiac portion of our assessment. So for this one, I'm going to, could you position yourself a little bit more up? Cool. Excellent. Thank you. So for this one, I'm going to check his carotid artery. I'm going to inspect to see if I can see his carotid artery pulsating. It is not pulsating. Now I'm going to check his carotid artery. Okay, so I checked his pulse for 30 seconds. It came out to be 40. Times that by 2, his pulse is 80. Now I'm just going to check his right carotid pulse to make sure that I feel the same pulsation, to make sure it's his pulse on his left side was regular, and I'm going to make sure it's the same on the right side. I would do this by going on the opposite side of the bed. That's a good pulse. I notice his pulse to be strong and regular. Okay, so now I'm going to have you lie down further on the pillow if you don't mind. So now I'm going to check for jugular distension. I'm going to use my pen light. I lowered him to 30 degrees on the hospital bed, and I'm going to check his neck to see if his jugular veins are distended. I noticed no distension. If he did have some distension, I would raise him back up to that 45-degree angle to see if the distension had receded. Excellent. So this one I'm going to take the pillow away, and I'm going to have you lie completely flat on the bed. Something just made a noise. It's okay. Cool. So this one, now I'm going to check his apical pulse. I'm going to make sure that I can hear the S1 versus the S2, the lub-dub. So the apical pulse is going to be around the fourth, fifth intercostal space on the mid-axillary line. I'm going to check for the pulse, and I'm going to measure it for 60 seconds. I'm just going to lift your shirt up just a little bit, okay? He has an apical pulse of 67. I noticed for the apical pulse, the lub is loudest at the apex of the heart. This is when the AV valve closes. To hear the dub loudest is going to be at the base of the heart, which is going to be up top. And that is going to be when the semilunar valve closes. Good. So I need to get this pillow back. Okay. Now I'm going to have you sit up. And then you can have your feet over the bed. A little closer to the... Fantastic. So that ends the cardiac segment. To go further into testing or diagnostics, what we can do is to get some lab results. We'll take some blood to check our CPK levels, our PT and PTT, hemoglobin and hemocrit, as well as an EKG for more testing. Okay, so now we're going to go into the lungs. And for this one, I'm going to start by checking his pulse. May I have your hand? Actually, do you mind just lying down? Sorry. So I didn't check his pulse. Instead, I was checking his respirations. So I checked his respirations for 30 seconds, and I got 8. Times that by 2, we have 16. So his respirations are 16, which is good. Good. So now I'm actually going to have you sit up, legs over here. A little closer to the bed if you don't mind. Excellent. So I'm going to check his position. I'm going to see if he's breathing by using any accessory muscles, if he has a barrel chest. This patient looks relaxed. I'm going to check his facial expressions to see if he's apprehensive. He looks relaxed. Very good. So now I'm going to have you stand up and face the closet. A little closer to the wall. Thank you, thank you. So now I'm going to check for his lungs and symmetry. I'm going to place my thumbs around T9, T10, and I'm going to have you take a really deep breath through your mouth, and then just breathe out through your mouth, okay? Okay. So breathe in, breathe out. Breathe in, breathe out. Good. So my hands moved symmetrically, noticing that his lungs, he can breathe in and breathe out fine. So now I'm going to go into check for tactile firmitus. Yes. So what I'm going to do is I'm going to place my palm alongside, Nick, what I'm going to do is every time I move my palm onto the other side of your spine, you're going to say 99 in a very good, deep, kind of loud voice, okay?
Okay.
Okay. So we're going to start up here, and we're going to go all the way down to check for vibrations. Okay. Say 99.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Very good. Thank you. So I had symmetrical vibrations, mostly felt on the upper side of his body, and I noticed it diminished going down the spine. So now I'm going to percuss to notice I'm going to feel for a hollow noise on his lungs. This will indicate to see if there's any fluid in his lungs. So you don't have to do anything. I'm just going to take my hand and go on the outside of the spine all the way down, okay? During this, I noticed nothing was dull, everything was hollow, so his lungs are good. So now I'm going to put a stethoscope up your back, okay, underneath your shirt. Now I'm going to also tape for lung sounds. So Nick, every time I move the stethoscope on either side, I'm going to have you take a deep breath in and out, okay? Just let me know if you start to get dizzy. Breathe in and out. You can breathe out fast. In, out, in, out, in, out, in, out, in, out. That was a good one. In, out, in, out. Check over here. In, out. Over here. In, out. And on this side. In, out, in, out. Good. You may have a seat. So my patient had very good breath sounds. He had no crackles, stridor, or wheezing. They were nice and clear. And that concludes our lung assessment. Any follow-up testing I can do is a atrial blood gas exchange, a pulse ox, and yeah, that's it. All right, so that concludes my cardiac, thoracic, and breast examination. Thank you for watching. Be sure to like the video down below, and don't forget to subscribe to my channel. I make videos every Wednesday.